Hi, good morning again, everybody. Thank you very much for joining us this morning for a webinar, Scaling Up Community-Based Disaster Risk Reduction in the Caribbean. We're very pleased with the interest that we've been getting on the webinar. This is our first of a three-part webinar series on community-based disaster risk reduction and ecosystem-based disaster risk reduction, being held by CANARI, and very pleased to say in partnership with the Caribbean Disaster Emergency Management Agency, CDEMA, as well as the International Federation of Red Cross and Red Crescent Societies, or the IFRC Caribbean Office. So this series is being held under the Inter-American Foundation funded project, CSOs for Disaster Resilience. I'll give a bit more of a background on that a bit later on. But just to say that this is a 3-year project that has been implemented by CANARI and partners from 2019 to 2022. My name is Candice Ramkasoon. I'm a technical officer and the project lead for the CSOs for Disaster Resilience project. And joining me is my team from CANARI, Dr. Ainka Grandison, who is the lead on our resilience program, as well as technical officer Daniel Moran Johnson and junior technical officer Aaron Peter, who will be supporting us with any technical issues that we may be having. Also joining us are colleagues from CDEMA. I'm very pleased to have with us the Executive Director of CDEMA, Ms. Elizabeth Riley, as well as Mr. Clyde Murray, who serves as part of the Project Steering Committee representing CDEMA on the CSOs for Disaster Resilience project. And we also have representatives from the IFRC Caribbean, Ms. Velda Ferguson-Dewsbury, and I believe Ms. Keisha Sandy will be joining us a bit later. As well, I'm sure there are several other colleagues who will join. So just to jump right in and get us started with a bit of virtual housekeeping, I'm sure most of you are quite familiar with this by now. Just would like to ask all of you to please keep your microphone on mute unless speaking, and also turn off your camera unless speaking, just so that we can help manage bandwidth. Please use the chat box if you have any queries or if you're experiencing technical issues. We would like to ask you to raise your hand or use the chat if you wish to ask any questions, and there will be Q&A later on when we have guest presenters. We will be recording this session and we will share the link to that recording as well as the slides to all participants. So just a brief background on the CSOs for Disaster Resilience project, under which this webinar is being held. This project, as I said, is a 3-year project that has been supported by the Inter-American Foundation. CANARI has been working with 6 partner CSOs or civil society organizations in Grenada, Antigua and Barbuda, and Dominica to implement this project. And the goal is really improve resilience for local communities, associated livelihoods, and ecosystems to hurricanes and climate extremes, really using or looking at community-based and ecosystem-based disaster risk reduction approaches. So just very quickly, the 3 main components of the project, one which has to do with both technical and organizational strengthening or building capacity of the partner CSOs that we are working with. And beyond building that technical and organizational capacity, supporting them to undertake practical actions for disaster risk reduction and to build resilience. And a third component, which is where this webinar is relevant, which has to do with knowledge mobilization and partnerships. And so we did have one virtual regional webinar some of you may have attended in 2020. And this webinar series that we are having now is actually intending to continue dialogue and continue conversations around community resilience in the Caribbean context and what does that really mean. So in terms of the overall goal of the webinar series, it's to further knowledge exchange, learning and dialogue on building community resilience in the Caribbean with emphasis on community-based and ecosystem-based approaches. On this particular webinar, as I said, it's the first in a series, so we will be focusing on community-based disaster risk reduction and what is needed to scale this up. The further 2 webinars we will be holding will focus on slightly different themes including gender and social inclusion and just nature-based solutions. And as part of this webinar, we are hoping to also highlight initiatives, innovations and best practices, lessons and recommendations for enhancing or scaling up community-based disaster risk reduction in the Caribbean. And you'll be hearing from a couple of guest presenters on what they are actually doing. Hopefully that also spurs some conversation. So just a brief review of the agenda as we continue. After me, I will be handing over to Sedima to share opening remarks, and followed by 3 guest presentations, each of which will be taking up a half an hour time slot. And we have factored in at least 10 minutes or so for questions after each presenter. And one of my colleagues will actually help to moderate that session. So we'll be looking out for your questions and so on in the chat. Or as I said, you can put your hands up if you would like to ask a question, following which we will wrap up. So as I move on, what I would like to do now is invite Ms. Elizabeth Rowley, who is the Executive Director of CDMA, to join us for the opening remarks. And I see Ms. Rowley has just seen on her screen. Thank you very much. What I will do is we do have Ms. Rowley's bio, and I will post this in the chat, but I would like to invite Ms. Rowley to go ahead and go ahead with the opening remarks now. Thank you very much.
Thank you very much, Madam Chair. And the partners from Canary, the IFRC Caribbean Office, National Disaster Coordinators and representatives of National Disaster Offices, representatives of national societies, civil society organizations, ladies and gentlemen, good morning to all of you. So colleagues, we all know that in disasters, the safety of people matters. As such, the readiness of communities as the front line in disaster management is critical. Communities throughout the Caribbean region exist within a complex and evolving multi-hazard context due to our exposure to a wide range of natural hazards, including earthquake, volcanoes, storms, extreme temperatures, droughts, floods, and landslides. Climate change, as we know, is in motion and gaining momentum, exacerbating hydrometeorological hazards and the associated secondary hazards. Climate impacts are also increasing, and so are damage and losses. We have all witnessed the resultant socioeconomic disruption impacting lives, livelihoods, life chances, and development trajectories. The intricate interaction between our level of care for the environment with respect to matters such as deforestation and degradation of the ecosystems has the power to tip the pendulum either towards or away from greater resilience. But we also know that some communities are more vulnerable than others, and their populations live with the constant threat of being affected by disasters, which are becoming even more frequent. But communities are not homogeneous. Disasters have a particularly damaging effect on the most vulnerable. Disasters affect women and girls differently due to gender inequalities. We also know that children are likely to be affected to a greater degree by the effects of disasters, and similarly, shocks can negatively affect people with disabilities. It is therefore important for us to examine which factors can reduce the loss of life, enable successful recovery, and generate resilience, including the impact of social capital such as social networks and interactions. But whilst communities are the first to be affected, they're also the first to respond in times of emergencies. With knowledge of the local hazard context, geology, livelihood options available, local communities, including the most vulnerable groups, must therefore play a leading role in disaster management programs, developing the capacities and the linkages that help to manage their risk and increase resilience. In essence, community members play a vital role in reducing the impact of a disaster. The Caribbean Disaster Emergency Management Agency, CDMA, recognizes the intricate linkage between climate change, disasters, and development. In fact, our Comprehensive Disaster Management Strategy, or CDM 2014 to 2024, advocates a holistic approach to disaster risk reduction and climate change adaptation. It addresses all hazards, all people, and all sectors. Priority Area 4 of this strategy specifically seeks to achieve strengthened and sustained community resilience. And community resilience refers to the sustained ability of a community to utilize available resources to respond to, withstand, and recover from adverse situations. Improving community resilience supports not only reduced vulnerability, but also more cost-effective service provision in response to shock. We at CDMA strongly believe that community resilience stems from effective engagement with communities and is a critical factor in achieving national and regional resilience. It is with these issues in mind that the Caribbean Pathway for Resilience, developed collaboratively by CDMA, its participating states and regional partners, and endorsed by CARICOM heads of government in 2018, provides a platform for addressing public policy on how we engage, rethink, retool, evaluate, and rebuild communities to withstand the impacts of climate change in this century. The Caribbean Pathway for Resilience sets the basis for a Caribbean resilience framework, which is built around 5 interrelated pillars, specifically social protection for the marginal and the most vulnerable, safeguarding infrastructure, enhancing economic opportunity, environmental protection, and operational readiness and recovery. It also provides the political value proposition for a resilient state and space for a collective conversation on how this can be realized, examining roles, capacity needs, and resourcing. CDMA's Community Resilience Program is built on CDMA's Community Resilience Program is built on a community-based disaster risk management framework, which forms part of the wider comprehensive disaster management approach and primarily supports Regional Outcome 4.1, where we treat with standards for safe communities being developed, agreed, and applied. The community disaster-based framework also supports other initiatives advanced by the coordinating unit to support our participating states. These include our program on multi-hazard early warning systems and our Youth in Comprehensive Disaster Management Program. And in addition, the coordinating unit has initiated the enhancement of community-based disaster risk management tools, such as the Caribbean Community Risk Information Tool, also known as the Secret, which I'm sure you'll hear a little bit more about during the seminar, the Standard Community Resilience Framework, and the CDM Community Resilience Program Implementation Guide. So going forward, scaling up at the community level must involve the preparation of communities for the unexpected. And we have to recognize that past assumptions and actions undertaken based on those assumptions may no longer be valid. In addition, we need to scale up local capacity. Important aspects of our resilience building should include providing support at the household and community levels. For instance, we need to ensure that we have effective and efficient social protection systems to protect persons from the impact of shocks and provide opportunities to integrate within the community resilience programming those mechanisms that treat livelihood protection. I wish to applaud this initiative by CANARI and other partners on this regional webinar series. We certainly hope that the engagement from this activity with further knowledge exchange, learning, and dialogue on building community resilience in the Caribbean. CDMA stands committed and ready to support activities that foster effective community engagement towards achieving safer, more resilient, and sustainable Caribbean states. Thank you very much, and best wishes for a very successful webinar. Back over to you, Madam Chair.
Thank you very much, Ms. Riley, for those very insightful remarks, and a very, also very, always interesting and informative in terms of the work that CDMA is doing in the region and in the participating states, what you have been supporting. And definitely, I definitely agree that, and I think that's why we are all here. The work that we are doing must involve the preparation of communities, including for the unexpected. So with that, I would now like to move us on to the next session, which is really our guest presentations. And our first guest presenter is Ms. Maria, who is the Community-Based Disastrous Management Officer at the Civil Defense Commission in Guyana. She will be presenting on building community resilience in Guyana. And so as she gets ready to present, I just would like to ask all participants, if you can please, I see you are using the chat now, I think it's working, so please include your name and organization when you use the chat so that we know who has joined us. We very much appreciate that. As earlier, in terms of the interest of time, what I will do will be posting the presenter bios in the chat so you can take a read and get to know a bit more about our presenters today. So Maria, are you ready to go?
Okay, good morning, everyone. My name is Maria Harnarai from the Civil Defense Commission, Guyana. I would just like to say all protocols observed before I head into my presentation. So today I will be presenting on building community resilience for disaster risk management in Guyana. And I would just like to give you a little background of the Civil Defense Commission and what we do. So the Civil Defense Commission is Guyana's national disaster risk management organization. We're responsible for planning, coordinating, and responding to disasters at the community, regional, and the national level. Some of the disasters or emergencies that we respond to would be either geological, these would be earthquakes or landslides, hydrometeorological, these would be droughts and floods. We also respond to chemical and industrial incidents. These would include oil spills or mining accidents or any chemical or industrial emergencies that may occur. We also take responsibility in coordinating activities around social or technological emergencies. These can range from civil unrest to cyberbullying to problems to issues with national security in relation to technology. So the Civil Defense Commission has a community-based disaster risk management program that we undertake continuously throughout the year. It involves a number of stages where we engage communities and vulnerable groups to ensure that there is integration of disaster risk management at the community level. So some of the activities would involve getting to know the communities within our country, what level of exposure there that exists to hazards, who are the vulnerable people within these communities. Based on these factors, we would select the communities that are most vulnerable to implement our CBDRM program, or prioritize, I should say, the communities that are more vulnerable. In selecting those communities, it is important that we build rapport and understanding with these communities. So some of those things, some of the activities that would involve would be regular visits to the communities, and to some extent living in the communities to understand the way of life, the language, the culture, especially in the case of Guyana, where we have two varying groups of people who live completely different lifestyle. We have our coastlanders and we have our indigenous group. Especially for our indigenous population that has specific cultures and norms, and to some extent, very different language from the English language. Some of them would speak their indigenous language. So it is important for us to visit those communities, get to know them, get to understand their dynamics, their leadership. Once we have that understanding, we're able to prepare a package and deliver to them and conduct participatory disaster risk management. This would include the conduct of or the implementation of various tools where we engage all members of the communities from various groups. So these would be women, children, leaders, nurses, teachers, police officers, firemen, if there are those persons that are in the community. And we would conduct participatory disaster risk management, where the community would come together in a workshop. We would go through various tools, which I will explain later, to get an understanding of the risk profile of the community and what necessary steps may be needed to ensure resilience is implemented in their development. So also included in our community-based disaster risk management program is a component of early warning system. So the community-based early warning system would take similar steps as our CBDRM program. However, it would include a monitoring and communication component where we try to help communities to understand ways to access and gather weather data or weather-related data. In communities where we may have seismic devices, we would try to get the community members to understand how these devices work and how to monitor them or how to check with them. For communication, we would try to understand what are the main ways of sharing information within these communities. Oftentimes, we would have communities in Guyana that are completely cut off or remote, and their main means of communication would be via radio or via loudspeaker. So in trying to understand these two important components, we're able to develop simple community-based early warning system plans for communities. Importantly, we have a gender consideration factor that we implement in our programs, in our community-based disaster risk management program and our community-based early warning system program. So this would involve activities such as collecting disaggregated data by sex, age, and how those are impacted by disasters. We have a gender sensitivity, vulnerability, and risk assessment survey that we would also implement and collect data through. We try to ensure that men and women have equal rights to access the information and resources we provide during our workshops and during our program. We try to develop gender sensitive disaster preparedness and response planning at the community level. So in developing the plan, we try to ensure we consider the dynamics of the community. What are the important roles that women play and how we can translate that into their community plan. We ensure that we have a checklist that helps us to achieve all of the above that I mentioned. So we have a community-based gender integration checklist that helps us to ensure we conduct all of these activities and include them in our program. So I will just give you an overview of some of the tools that we use for data collection within our CBDRM program. So we do hazard mapping, we do surveys, we do a hazard matrix, we do focus group discussions, we do a historical timeline, we do seasonal calendars, and we do transient walks. So I will just show you some images of what some of these activities look like from previous communities where we would have gathered these data. And of course, we also do gender assessments. So we have a rapid gender assessment on the first image on the slide. So what we do, we have the communities list some of the main activities that would occur daily. This is from one of our Indigenous communities. The name of this community is Riwa. And some of the activities that they would have listed, we have earning cash, we have fishing, we have preparing for flood, caring for children, attending community meetings. And we have the communities identify who plays the lead role in these activities before a disaster, during a disaster, and after a disaster. This helps us to understand what role men and women will play in the disaster plan or in the community plan. Who should be assigned specific activities for to take the lead role in ensuring that it's done in the event of disasters or emergencies. We also do a seasonal calendar. This is to help us gather historical data and traditional knowledge that was used in the past. This would identify some of the activities that would happen throughout the year and how disasters or incidents would occur during that time. So we would have persons list out some of the basic activities that happen and then list out some of the disasters or some of the emergencies that would affect the community. So we have in the second image, we can see we have agriculture where we have pest and disease damage. We have health hazards, we have species and endangerment, floods, and so on. And the communities would list out the part of the year where these activities are more prevalent. What we would do then is we would pair this with some of the economic activities that occur so they can see the comparison as to how those activities or how those emergencies impact their economic activities or their other social activities. And it will help them to better plan. Okay, so maybe during May, June, we have a lot of rain. So this may not be a good time to plant a certain type of crop, and it may be better to plant a crop that they can reap easier or earlier. So the seasonal calendar helps community to understand that. We also do a risk assessment or a risk matrix where we have the communities rank their hazards. So they have an understanding of what is the most impactful hazard or the most impactful disaster. So they can know how to pool resources or prioritize resources into that hazard. This is a hazard map. The communities always find this very exciting to do because they get to lay out their communities and identify the areas that are most affected by various hazards. The communities are also very proud and they feel some sense of accomplishment when they see these images in their community plan when it's delivered to them. This was also from the community of Rewa. This is an Indigenous community that has an eco lodge and a community residing along the river with the eco lodge. So the eco lodge is managed by the community. And it's one of the vulnerable areas because it's highly influenced by the river that runs along here. This community is affected by flooding, and they also have issues with poaching of one of their endangered species, which is the Parrotfish. So when we did the CBDRM activity with Rewa, the community would have understand like what seasons the arapaima may be poached more, what part of the year they may be having flood more, and they kind of understand what sort of correlation these different activities may have together. So additionally, we do a historical timeline. A historical timeline identifies the activities that would occur within a community over the years. So we go back as far as maybe 100 years to have the community sort of list what incidents would have occurred and how that has changed over the years. So in the community of Rewa, these are some of the icons, and I will tell you what they represent, that they would have identified as hazards or emergencies that would have occurred. So the first dot, it looks a bit like Chinese writing. It's actually an ant, and it's called an akushi ant. And this is an ant that destroys their crop. The second
icon will be the arapaima fish, and this basically represents the core chain of that fish. And the red dot would be dry season. So if you look at this map, or if you look at this diagram, you would see the hazards would were decreasing, or they start to have less issues with different hazard as the year go by. However, you see the emergence of a new hazard here in 2010, which is floods. And this is significant data for us as a disaster management office, and as well for the community, because we understand how the natural environment is changing, and also how climate change is exacerbating different events in communities that may never had such hazards before. So those are some examples of some of the traditional way we would have collected data, and some of the ways that we conduct our CBDRM activities to collect data. However, as a result of COVID during 2020, a lot of our community-based activities were halted or were paused, and we were having a lot of issues with social gathering and traveling to communities to get some of these activities done. So what we did a digitization process where we transformed a lot of our work to be implemented virtually. However, the disadvantage with this is the communities that were remote or cut off, we were not able to do any activities in those communities, but we were able to get some of the digital work done with communities along the coastline that had good internet access. So I'm just going to show you some of the work that we did in digitizing our CBDRM content. So we would have conducted our workshops and training via Zoom. We did a lot of focus interviews with key sector representatives within the communities. These were done via phone calls and over WhatsApp or Zoom. We used Cobo Toolbox to collect risk data, and we utilized Google Maps and other GPS mapping apps to develop maps for those communities. So previously, the communities would have developed the maps themselves during our in-person visits. However, because we were unable to visit these communities, these were some of the alternatives that we developed to ensure that our community-based disaster risk management program is continued. So we use Cobo Toolbox to develop questionnaires and surveys, and these will be sent to persons directly, and they fill out these questionnaires and we collect those data. So this is our community vulnerability and capacity assessment. It allows the persons to select what area they're from. It allows them to pinpoint their exact location by a map that's embedded into the survey. And it allows them to also do that vulnerability and capacity assessment via a rating. Of course, the survey is a lot more longer than this, but just for the purpose of this presentation, I just put a few sections of what the survey would have captured. We use an app called GPS Essential to develop some of the maps in the communities. So what we would do, we would have the community members access the app via their cell phone, and they would walk around, and it would track, or it would create a track, which we would then access. It also allows them to take out pictures of the specific areas that have hazards or that have been impacted by hazards, and then we get this digitally as well. So this is one of the maps that we would have created for REWA, where we would have demonstrated the communities how to get this done, so they can provide us with this feedback or this map. Our hazard assessment tool, we also digitized this into an Excel, and we inserted the formulas into the Excel. So when we're delivering the presentations over Zoom, the persons can put in their rating, and it's automatically updated on our end. For our historical profile, we did the same thing. We developed some Excel formulas and some Excel graphs where we would ask the communities what are the hazards that affect them, and we would give them a scale of 1 to 100, and they would tell us, well, in this year, they think that flooding was on a scale of 1 to 100 at 90. We would, once we input this into our Excel formulas and our Excel data, we are able to generate these graphs. The only disadvantage to this, I would say, is that the communities would not see their own handwork in the final plan, and it will be completely digital. And that's something the communities do look forward to in seeing the work that they created in their plans. So this is also another example of how we would do the hazard mapping. We would pull up a Google map with the location and have the communities identify on the map by Zoom what are the problem areas, what are some areas that have critical infrastructure that may be affected by hazards, and so on. And we were still able to develop some of these important aspects of our CBDRM program. So this is an example of what our CBDRM program would look like. Our CBDRM plans, once we would have completed the methodology and collected the data and presented to the communities. It would include a community profile. It would include what the CBDRM committee would include. It would include an early warning system component, and it would include how to ensure sustainability of the plans. So some of the challenges that we would have with our CBDRM program is that we have a limited amount of trained and available implementers for CBDRM. Currently, I am the only community-based disaster risk management officer employed with the government. We have volunteers who are trained in implementing CBDRM. However, their availability is based on their schedule and when they're not working and so on. So a lot of the CBDRM work is kind of condensed or left up to the commission alone or up to myself. Guyana is a very complex country that has a lot of communities that are remote and cut off. And the logistics of moving around the country and getting to those communities are very challenging. There are communities where you literally have to travel for about 18 hours to get there, and sometimes an entire day before you arrive to your destination. There are some communities where you may need to overnight at one place before you can move and get to the other location. So those are some of the challenges that we would have in moving around, especially with getting the resources to move and ensure that all of these communities are covered. We also have very limited funding available for community-based work. A lot of our disaster management funding tend to go a lot to response and tend to go a lot more to more national level projects. So oftentimes our CBDRM program can only fund 1 or 2 communities per year, which is quite challenging considering the amount of communities that are exposed to hazards and that are vulnerable and are in need of DRM intervention. We have a very challenging financial system as well in Guyana, where we have a national procurement law that requires quotations and certain financial arrangements for the government to issue payments. So when we work in very remote cutoff communities, this financial system becomes a burden into paying suppliers to get resources in those communities to conduct our work. A lot of our remote communities have Indigenous population that speak Indigenous language, especially the older population. And we have a problem, well, I shouldn't say a problem. We now have a challenge with migrant population increasing a lot along our borders. And they speak a completely different language, which is Spanish. And we do not have a lot of Spanish CBDRM implementers. So that is another challenge that we have in terms of culture and language. There's also a challenge of access to stable and reliable internet connection for virtual workshops and training. Like I mentioned earlier, when we were when we were implementing our virtual CBDRM program, the remote communities or the communities that are more in Guyana's hinterland, we were not able to implement in those areas. And we were only able to implement in areas that have good internet access. So some of the future plans that we have for CBDRM, especially to help us target some of the challenges that we have, we definitely want to do more training of trainers of CBDRM with volunteers across the country, especially targeting the remote areas that we have challenges with implementing the program in. We want to do training with other civil society volunteer and partner groups to help us implement CBDRM. We'll try to levy support from private sector to help us secure some of the equipment and tools that we have challenges with finances through the government system. We want to revise our CBDRM content and methodology so it's implemented over a shorter time frame. Currently, our CBDRM program takes about a month or two to be completely implemented and covered. So we want to revise that so that it's done in a shorter time period without affecting the delivery and the content. We want to revise our CBDRM plans to be more community friendly. This is something we're currently working on and we're currently doing. Previously, a lot of the plans or the templates that we would have, it would have been done through partnership with other agencies like UNICEF and the United Nations. So a lot of the templates that we have were very complex. So we're trying to revise them to be more community friendly, especially to suit our Indigenous population and to develop plans that are more tailored to them. We want to continue to digitize our other content of the CBDRM program, such as the Youth for CBDRM or our Youth for CBDRM program. We want to digitize that program as well so that it can be delivered in schools virtually. We want to integrate more impact assessments and early warning monitoring components in our CBDRM program. We're planning to review our primary, secondary, and tertiary curriculum to identify areas where we can integrate more CDM and CBDRM content. We want to tailor training programs and materials to better suit our Indigenous culture and try to integrate more Indigenous language in our program. This would involve training persons who speak the Indigenous language as well to implement those activities in their communities. And we want to work on improving our community risk profiles so we can collect more comprehensive data, more in-depth data, and try to triangulate those data better with current scientific research that are available. Currently, this is how CBDRM is linked at the national level in Guyana. We have a national disaster risk management platform, which is we have a national disaster risk management platform that manages disaster management at the national level. So Guyana has 10 administrative regions or territories, and each of those territories has a regional disaster risk management system. And connected to those systems are communities. And this is where our community-based disaster risk management plans or committees are connected to. So this is the hierarchy that the CBDRM program follows in Guyana and how it's connected at the national level. So just a few recommendations to improve or scale up CBDRM at the national level. and in the Caribbean. I think we definitely need more opportunities for collaboration between participating states to ensure that the best practices and experience are shared. And I think we need to do more in publicizing our community-based DRR work so that other countries and communities in general are aware of the work that are being undertaken. So in conclusion, I think CBDRM is a very important program for communities within the Caribbean region, considering our high level of exposure to hazards and the number of persons that we have that are vulnerable. We have a large number of vulnerable groups. Prioritizing programs such as CBDRM is important in that it contributes directly to building people's resilience. And I think once we build resilience with people, we build resilient community and we'll have resilient nations. Thank you.
Okay, so thank you very, very much, Maria. That was a really, I think, informative and interesting presentation. And I know we would like to have some time to have all of the various participants that we have here ask any questions if they have any. But maybe firstly, I should just quickly say good morning to everybody because I didn't initially introduce myself. So this is Ayinka Grandison from Canary, and I'll be doing the moderation for this guest presentations. And I think I'm actually going to take the opportunity as moderator to ask the first question because I was very interested in the presentation that you gave, Maria. And what I was thinking about was that you'll have some very innovative tools where you try to digitize all that work to do the assessment and planning with the communities, which I thought was very innovative. But then you noted the challenge of many of the most vulnerable communities, maybe in the remote interior, don't have Wi-Fi access and aren't actually able to engage in those virtual digitized kind of approaches. And I can also see that some of the migrant populations also may not have good access as well. And so what are some of the strategies that you guys are thinking about implementing to improve how you're able to work with those types of communities, given capacity constraints, resource constraints? Is it to set up community disaster committees? You know, what's the mechanism to kind of reach those more vulnerable remote communities to really support their disaster risk reduction?
One of the initiatives that we are actually planning to take is to identify specific groups, so migrant group, Indigenous group, and have them trained in implementing the CBDRM methodology, providing them with the content, providing them with the package, so they can take that to their communities to be implemented. In terms of fixing the issue with access to internet, that's more of a national level intervention that may be needed, especially with our telecommunications ministries, to ensure that, well, it will be a very challenging effort for the government to ensure that the entire country has access to internet, considering Guyana's landscape and geography, and the nature of us wanting to preserve a lot of our areas and keeping them natural and cut off as well. So to help with those areas that has to remain intact or natural or cut off, we would have to train persons from those areas to implement those activities in their communities, because it will be a lot less challenging to have a group travel to Georgetown, where the capital is, and have them trained and provide them with the materials and have them go back and implement and set up those committees in their areas.
Okay, yeah, so I mean, definitely understand the constraints, but I think that is a practical way to move forward. And so good luck in kind of trying to get that done. I see we have a couple of questions here. So one is from Andrea Kings in the Q&A, which is asking, how did you get the Indigenous communities to buy in and cooperate to implement the disaster risk reduction strategies, I guess, once you have developed the plans with them?
So the Indigenous communities are actually the less challenging communities to implement or to come on board with CBDRM. They're the ones they have a more structured community sense of organization, especially considering the fact that they know they're vulnerable and they know they're exposed to these hazards. They're always willing to accept and implement. The only challenge that we have really is the sustainability of the resources and the finances for them to continue the program. However, they maintain their committees, they maintain their meetings, they maintain updating CDC on incidents that may occur in their community. But the challenge is their local financing and financing trickling down from the national level to ensure DRM activities are sustained in communities.
Okay, yes. I mean, I think that definitely makes sense. And I noted that, I don't know if it's a colleague of yours, Shamisa David, noted in the chat that they're going to be establishing ICT hubs across many of the remote communities, maybe including Indigenous communities. So that should help with accessibility.
Yes, that's true. The government has been doing some work with establishing community ICT hubs and also training students in STEM and other ICT areas in those remote locations. So maybe in the next few years, we can have more digital implementation across the country.
Okay, so that's really, really interesting. Are there any other questions? I'm not seeing anything else in the Q&A or in the chat right now. I think we can probably take another 1 or 2 questions before we switch to the next presenter. So there's a question from Allison Garnier from Bahamas Red Cross Society. So how long have you been conducting community-based disaster risk reduction activities?
So for me, I have been conducting CBDRM for about 3 to 4 years. However, CDC Guyana has been engaged in these activities as far back as 2012 to 2005, I would say, to some extent.
Okay, so 10 years almost, you guys have been kind of working on this. So that's really interesting. And I think you've gotten some good experience under your belt. And actually following up on what she just asked, I know that there was a lot of flooding recently, both in Guyana and Suriname, in terms of a recent kind of disaster. How do you think the communities have been able to cope based on the work that you all have done with them on trying to improve their preparedness and their ability to kind of cope with some of these major kind of disasters that we expect to get worse with climate change and those types of impacts as well? Have you seen an improvement in their ability to cope?
So I will give you one example of a community that I would have worked with, which is an area that has been affected a lot almost every year. It's an area called Fukwani. We would have done a CBDRM program back in 2018. Prior to us doing the program, that community did not understand or have any idea how to report issues or emergencies in their community. So year in, year out, they would have continuous flooding with no idea how to access information or how to report the incident until maybe a regional official would go in and they would realize that the area is flooded. So through our CBDRM program, they got an understanding on how to report issues that may occur in their community, how to access information. Some persons were also trained in community emergency response teams, or CERT. Most persons would be familiar with that. So whenever there is an incident or whenever there is a flooding,
we set up shelters, those persons would be integrated into the shelters to assist with managing the shelters. They would assist with public information in helping the communities to use their water properly when there is a flood. They would assist with distributing relief supplies. And this is all because they would have gone through a CBDRM program and they understand the sense of community, a sense of community unity when there is a disaster, and they understand that some of the responsibility or some of the efforts should come from them as community members to ensure that their community is resilient.
Okay, so I think with that, I'm actually going to have to wrap up. I see there's actually several questions in the chat, so hopefully you'll be able to take a look and respond. I think there are at least 3 or 4 more questions for you, but the last one that I actually was going to just flag is someone was asking about kind of how did you guys approach your digitization and what kind of resources are available. So I don't know if it'd be useful for you to share maybe what apps you all have been using in terms of being able to allow the communities to be able to access whether via their mobile phones, and if y'all got specific funding from a particular funder to help you do that switch to the digitization. I think a lot of the other practitioners here would be interested in knowing about that.
So actually, a lot of our digitizing work were done by volunteers. CDC has a good support system for volunteers, and a lot of the content were digitized by the volunteers. A lot of the tools that we use, like the historical profile, the historical timeline, were done between myself, and I had some support from volunteers that help us to develop the content. In terms of the tools used for implementation, all of them are available free of cost. They're all humanitarian based tools that we would have learned about or we would have been exposed to through various partnerships with other civil society and NGOs. So our Cobo Toolbox, which is a mapping tool, that can be downloaded on either Android or Play Store. It's available free of cost, as well as our GPS Essential app that's available free of cost as well, that we access and use. And you can download those. What I can do, I can probably add some link on my PowerPoint before you share them and send it back to you, so you can know how to access them and get to them. I can also share our digitized tools with persons who are interested in having them to be implemented.
Okay, so thank you very much. I think it's a really, really interesting work and really important work that you guys are doing to help, improve disaster preparedness and build community resilience. So thanks very much for your time today and for your really, really interesting presentation. So I'll let you answer some of the other questions that have popped up in the chat, because people are obviously very interested in what you had to say. And I'll hand over to Candace to introduce the next presenter.
Okay, thank you very much, Maria, echoing Anka's sentiments, and thanks to Anka as well. So we want to move on right on to the next presentation, which will be given by Mr. Simon, or he likes to be called Leroy Jack Roberts, who is from the St. Vincent and the Grenadines Red Cross. And he'll be sharing on building disaster resilience in St. Vincent and the Grenadines, specifically focused around the La Soufrière volcanic eruption and the SVG community disaster response team. So I see he is getting his presentation ready. I will just give him a bit of time to do that. As soon as you are ready, you can please proceed.
Okay, let me say good morning to everybody. Indeed, it's an honor for me to do this presentation. Protocol already established. I will go ahead and share my information. So we will look at the aspect of disaster risk reduction in St. Vincent and Grenadines and the Cdrd teams. Okay, so building disaster resilience, lesson from the La Soufrière volcanic eruption and the community of St. Vincent and Grenadines disaster response team in St. Vincent and Grenadines, sorry. What are Cdrts? I must say before I share that point that Cdrt training is an age-old training of the Red Cross Society Federation. Have been used for many years, even before I myself have started doing training in 2008. Many training I have seen have been developed on it laid the platform for many other disaster training across the world globally. And I'm indeed happy to know that this training from Red Cross still do exist and still do continue to this point. It's a methodology used for training communities to better understand and be prepared to respond to any disaster within their community. So we train community personnel with disaster response skill to directly assist their community. So they become like first responders within their community on a whole. In the training, the community identifies and recognizes their vulnerabilities. They develop disaster and emergency response plan, and they do simulation to test their plans and reevaluate them. And they become, the Cdrt teams then become a part of the national system. So we will use things like VCA, which is a vulnerable capacity assessment, so that persons can assess their community to know the vulnerabilities of the community. And by doing that, they're able to identify these hazards using the same, one of the methods that have been used, explained before by our previous presenter, hazard map. We use the aspect of community engagement. They will identify persons within their community who are skilled workers. They will identify the stakeholders within the community. They will identify buildings that can be used as assets towards the aspect of disaster response. And they also will talk to business owners in case of emergency so that they can assist on a whole. So that the other thing that they will do in the aspect of preparing, looking through their vulnerabilities, and through these information that they will gather, whether they use VCA or whether they will use the problem tree analysis, they will develop their disaster plan. And the disaster plans are being assessed throughout the period by our National Disaster Organization. In our case, it's NEMO, National Emergency Center. They will assess it every now and then before the plan is finalized. So our NDO will continually assess these disaster plans to make sure that they fit into the national structure. So it is easier for them then to be implemented. They also will do their emergency response plan so that they will see how this plan can work, or they have a plan to be able to assess themselves in relation to respond. The disaster plan is one thing, the emergency response plan is another thing. The disaster plan is an overall picture, while the emergency response plan is how they will respond during the act of an emergency. As I said, the simulation is there to test them so that they can see if what they have on paper is actually workable. Some of the areas of training that are covered in the Cdrt training, we have the Cdrt and disaster risk management, so we help them to understand the linkage between them. You have the Cdrt and disaster preparedness. You have the Cdrt and the role and the structure. So then it's a section where you have leaders, their role, their responsibility, what they will do, what they want, who they can link with. All these roles and all these structures have been, they've been edified about them. The community assessment is being done, as I said before. They learn about stress management and psychological support. They learn about health in emergency, different aspects of things, public health, the challenge that they may face with relation to public health, maybe with water, maybe with sanitation, Watson. All these things that they will learn in their training. They will learn about fire safety. Well, we have our firemen who will come in and will explain to them more about fire. They will learn about communication, the aspect of using of radios and different communication means, and what best is being used at that time for communication, how they can communicate out if by chance maybe current go. So they learn how to use the CB radios and other mechanism of communication. They learn light source rescue so that they're able to know how to find persons who are displaced and who may be lost within their community. And they will learn about shelter management. They are being told how to manage shelter in this particular training. So that is our Cdrt team, which is known as the Community Disaster Response Team. So how do we integrate Cdrts into our national disaster plan? As I said before, all disaster plans, when they are being developed, the National Disaster Organization, our NEMO, will look through this plan. They will report on them, they will respond to them, they will analyze them, they will critique them, They will give suggestions. They will help them so that they will make sure that the plans are properly organized so that it will synchronize into the national plan on a whole. So they will have revision of the plan. The national emergency will comment and they will send them back so they can review it and update it so that they can fit into the plan. So it's easy transition when these Cdrts are preparing themselves, when they are doing their plans. So all Cdrt teams, after being trained by Red Cross, is handed over to NEMO. They are then integrated into the national plan, either through a district committee or through the community disaster structure. Because there may be some communities that may already have a structure for disaster response, while in some cases there are a mixture of different communities who make up a disaster structure, a disaster committee, district committee, then they may be integrated into it. It's an easy rollover because, as I said before, all the disaster plans are being assessed during the process of development by NEMO, so hence it is easy for them to fit in. But we will, after train them, Red Cross train them, we normally hand them over to the national system. Some of these persons later goes on to be trained by the National Disaster Organization, NEMO, to advance themselves and to become specialists in different areas. So we have out of these people they may decide to go into shelter management. Some of them maybe go on to become certified, where they don't just learn light search and rescue, they now learn search and rescue to the height. Some of them become operation managers, they become different things. But the foundation of them, the basic of getting them involved in disaster response will start with the aspect of the Cdrt training. Well, most persons are aware of our volcano eruption. And not only that, I remember being questioned and asked, how are we coping, knowing that the world globally is going through the pandemic of the COVID, and then now we being locked down. It's expecting a volcano eruption, which means persons will have to move from their home to another location. So we have to anticipate this disaster of our volcano eruption, and we prepared for it. There were many training and discussion with the Cdrt teams. NEMO will regularly have updates, we call them, we'll do many things. And one of the major things that Red Cross did is to refresh our Cdrts. So because we were on lockdown during the COVID time, we realized that we would have started, at the time I was working on a project called CRB, which is Community Resilience Building. And part of the methodology was for me to introduce Cdrt to the community that we were working with. And because of the lockdown, it forced me as a field coordinator to develop an online version of this training. And we did the training online, and then eventually we opened it up to the entire island so that persons who were Cdrts could be refreshed to prepare themselves for the response, and persons who were part of a Red Cross group but wanted to know more, or maybe a volunteer to Red Cross and wanted to know more about Cdrt, they could have joined. And that training, online training, was able to see over 100 participants across the world, across the country, Sims and Grenadines, participating. They were reported that in some areas, there were like 10 persons behind one device, because we might have had a limitation in relation to the amount of persons who could have been on the platform. So what some communities did is that they gathered in houses whereby either a church or a disaster or a group of persons will sit down behind one particular device, and then they will sit so that they get the training a part of it. We did 10 modules in this training, as we mentioned before. And also we had our partnership. And one thing I like to comment about Sims and Grenadines, and especially on NEMO, is the collaborative effort that they normally we work together, and they seek to have all the different disaster training personnel under an umbrella so we can call upon each other at any time. So at that time, the National Disaster Office, they would have participated also, sending their persons, their national trainers, to assist in this training online. They had the police doing their part online, and we had our Red Cross disaster trainers also being a part of it. So together, we collaborated, and we had this online training, which was our preparation in case and in preparation for the disaster eruption. So we had anticipated the disaster, and we prepared our communities to be able to respond. So as I said, we had both formally trained persons, and we had new volunteers being trained. And at this time, I want to say a very special thank you to our donors. As I said before, is that since about 2008, I have been a disaster trainer for Red Cross, working on different disaster aspects. Most at that time was DPECO. So we had ECHO, who would have assisted us in doing Cdrt training, because Red Cross depend highly on donation, and also depend highly on persons being able to partnership with us in order for us to roll out this training. So to have our communities over the years been trained in Cdrd, our donors must be thankful for. So we had ECHO at one point, we had USAID at another point, and the last one we had last year was Global Canada, which is through our partner in society, Canada Red Cross. And over the years would have been like Finnish Red Cross would have partnership with us to make sure that we have the finance and the funding to roll out this disaster training within our communities. And I must again say here that normally when these donors make the request or when these donors assist us, we normally have that close knit with our National Disaster Office, who will guide us to the communities best to work with, because they know the communities, they have the reports, they have all of the disaster impacts. So then therefore they will guide us accordingly. So that is why we have that close knit within our between our National Disaster Office and Red Cross to be able to roll out these Cdrd trainers. So to our donors and to our partners, I want to thank you very much. Becoming involved, the Cdrds in action. The volcano would have erupted, and then we had them now responding. On the right, you will see our hazard map showing the areas of our country that were at risk based on the aspect of color scheme. The red being the very high hazard, the orange being high hazard area, the yellow being moderately hazard, and the green being low hazard. We also had all our Grenadines islands being green. But I must say to us that every community on our island, and even further beyond our island, was impacted by the volcano. But those within the red had to evacuate. So then therefore, they became displaced. So we had it directly impacted, which was the displaced communities, those more so in red, and we had it indirectly impacted, who became the host community. Cdrds within the hazard zone, because they were the persons within the red zone, and they were trained already as Cdrd. What did they really do? So they helped out in assisting with the evacuation of persons from their community. That is now they're implementing it, what they were being trained to do into it. I remember one person reported and said that they had to use like blankets to help to move some of the disabled persons. They had to use a chain, which was being taught when the police would have taught them search and rescue, or even the fire would have taught them how to move victims in case of anything. They implemented some of these trainings that they would have had into helping to move the persons of them who are there. They were able to see their disaster plan go in action because they would have had a list of all their stakeholders or persons in whom were skilled persons. So they had a list of all the persons who had vehicles. So they could have called upon them to tell them, it is now time for us, or time for you to assist. So we had people with their vehicles, use their vehicles to help to evacuate, along with the methodology that the National Disaster Office would have had. They were directly responsible for communicating with NEMO as a form of communication, meaning that the National Disaster Office would have given some of the Cdrd teams radio so that they could have communicated with them directly through their radio system, so they could have known how things are, how people are moving, what kind of help they need, so that they will be able to get them out of there. Also, they were aid in search and rescue. And because of that, they were the last of persons to leave their communities. We had Cdrd persons who took the risk of understanding and also the responsibility to make sure that their communities were being emptied before they left and to go. They assisted at their shelter, at the shelter where they were placed. So even though they were displaced, they still assisted at the shelter. Some of them helped in the kitchen to cook, some of them offer PSS to persons, and some of them were even directly involved in giving the relief supplies. Some of them provided regular updates, whether it be to Red Cross or to NEMO, of how things are at the shelter or wherever they were placed, whether it be a private shelter or a government shelter. And as I said before, they assisted in the assessment, even to go back to their community to see how things are, to give report using whatever assessment tool we have. We have our damage and needs assessment, so they will go and help out in those areas. And they even went on to assist when relief were coming in, to give back relief to even the persons in their necessary areas that were being damaged, even though they were displaced. So those are the Cdrd personnel who are in a high hazard area. And these are some of the comments that were being made. Some person said the impact of the training had on them made them become more confident in their response. Some person said, I can say I am more resilient. I'm a more resilient person due to the training. Some people even went to say, I don't think I could have managed going through a volcano eruption. But I must say the online training really prepared me with the skills necessary or the know-how so that I can assist myself or help myself and also help others. Those were some of the comments that was being recorded from persons who were displaced and who were still assisting as a Cdrd member. We have now those in the low hazard zone, like the yellow and the green. They became the host community. Again, the National Emergency Office, because they are responsible for Cdrd, would have set up a strategy or methodology whereby the displaced, the low zone area or the low impact area, hazard area, will receive these persons as a part of it. So they receive them. Let me give an example. So we had the red zone, which may be considered some community like Cdlts. And then we had one of the yellow zone or green zone, maybe a community like Barrowly. Barrowly was responsible for receiving. So when persons came as a transportation, bring them from the red zone, they will receive them, make sure account, because before the eruption, the Cdrd teams would have assisted in taking track of all the persons who are living in the community. They had a record, a database. So when the receiving zone now had them, they was able to make mark off to have a count to make sure everybody was out safe. And that methodology was proven to be a success. So we had no life being lost during our volcano eruption. So they became the host community. They were responsible as shelter. They were responsible for receiving persons, and they were responsible for assistance. So the shelter management training came in very much in place for them at that time, where they were now able to host this person at shelter and manage some of these shelters. And they were also aiding giving out supply to the displaced community. So they were there to give food and other assistance, whether it be psychological, as counseling. They did all that they could have done as much as possible. Even within the Guyanians, one of our community, Beckway, did their part. They hosted persons, they allowed persons to come from St. Vincent to stay in their homes, and they make sure these persons were being well kept. So the methodology of the Cdrd training would have proven, even in their planning, would have proven to be a success in relation to the response method. But the truth is, over the years, we have always been using simulation to assess our Cdrds. But then now it was a real-time assessment. So the real-time, no more a simulation. And these are the key points that we need to take note. Plans were being tested, coming to recognize where they needed to do some adjustment or where they needed to review their communities. Communities understood better the importance of togetherness. Communities became more aware of their stakeholders and their responsibilities. National support structure was highlighted. Regional aid came into place. International aid was offered. Lives were saved through plans and structure. The resilience of communities were being demonstrated, and the list can go on and on. And at the end of it, what I want to say to us is that I can say that the A team, I love it when a plan comes together. And that brings me to the end of the presentation. Collaborating with our national disaster plan, all of the planning that they would have done, National Disaster Office, all the plans that these community disaster response teams, Cdrd would have done, their disaster team and their emergency response team. At the end of it all, we see the collaborative effort of all our stakeholders, all our agencies coming together and making it good. So we can all say, we love it when the plans do come together. I thank you.
Thanks very much, Silmond, or is it Leroy, for that presentation. That was really, really interesting and a nice kind of contrast to the previous presentation, really talking about the volcano and kind of how the community response teams worked. I think that was a really, really interesting, kind of very practical kind of example of, doing community-based disaster risk reduction and seeing what some of the impact is in terms of, as you said, it was not simulated, it was real time, there was a disaster, and you got to see how the teams responded and how it all worked. And so I think with that, I'll open up the floor I'm sure people have some questions, and so please feel free to raise your hand or write into the chat any questions that you have for Leroy about the work that they've been doing with their community response teams. So one thing I'm seeing here from Alison Garnier is, could you please share your online training for the Cdrts, or is that possible? Is it something that the wider maybe IFRC Caribbean is able to share with other groups?
Well, I believe we can share, because what happened is that we had to make that move because the project had a timeline, and in most cases we had to, which was the CRB project at the time, and we had to find a way to get to the communities. Like everybody else during COVID, how they would have had to develop something. What we did is to do the online version of it. So it's a more of a template of how it could work. We would have had some assistance from Suriname, because we had a national trainer there, which is Humphrey, who would have really guided us also too. At the same time, as I said, we normally have a good collaboration with our partners and so on, and our other Red Cross. It's something that, yes, I can share, but it's something that could be developed on, because we did the best we can do based on the aspect of what we had resources there at the moment.
Okay, yeah, so I mean, that's very useful to know. Thanks for that. I'm not seeing any hands up. There may be a couple of other questions. Oh, there's a question in the Q&A chat. So I think this is Mark Boyce asking, with the eruption in the midst of the COVID-19 pandemic, how did that change your approach to your response, especially at the community level?
Well, one of the things, as I mentioned before, that is where the Cdrd online training had to be developed. What it really taught us is to be innovative and to be creative in our approach. It helped us to understand and analyze that even though we may be limited with face-to-face, that people still can be reached. The good thing about it is that at the time of COVID, we might have still had internet access, but then at the time when the volcano erupted, we knew that people were being displaced. But because we were preparing during COVID, it helped us to better be able to know how to deal with it during the aspect of the volcano eruption. So in some cases, the area that were considered to be yellow and green, what we were able to do is that if we want to continue our training, we were able to actually do Zoom sessions. So in some cases, even during the training time, we understood that we can put up a projector and have multiple persons being at one area. So it's really helped us to show the importance of the digital transformation methodology, whereby we can now do digitally, and at the same time, and we did some incentive to kind of help to stimulate participants, because sometimes when you're doing training, there's always a case whereby you can't have everybody being online to kind of, train their faces, doing video. So what we did is that we used to do quiz at the end of it to kind of help to do an assessment so we can see, make sure persons, and it was a very competitive thing because it became a case whereby it was more communities are trying to make sure that they win. So they will be there making sure that they encourage the members to participate and so on. And it really showed that we can do it, even though we may be either displaced, or we can do it, even though we may be far from each other. And it really helped us to know that we can now use the digital world to continue our training and whole. It was a challenge, but it helped us. And I will always compliment persons who have initiative, a very good mindset, who think outside the box, who help us to be able to come together to make it possible to be able to do those training.
Mm-hmm. And maybe just building on that just a bit, did you all have to change your response in any way to COVID? So not just with the training, but with the actual interaction of the response team with people in terms of thinking about the spread of COVID, what was happening in the shelters, all of those things as well. Because I think that would have been also another kind of concern in terms of how you respond.
And that is why I said I'm very thankful for the methodology that we have in our country, whereby we hand over the Cdrd to the National Disaster Office, because they had a lot of meetings, we had a lot of collaborative meetings discussing that, how we can make sure persons are safe, how we can make sure that these things are, that because it was one of the concerns, because at the end of the day, we have to jam persons closer together when they were evacuated. So the government did their best to make sure that some persons would have left our islands and go to other countries. Just try to keep the crowd as minimum as possible. a lot of ideas came out, and that's why I say again, I want to thank the National Disaster Office for the approach, because they prepared, they thought about it, they considered every single thing, and they made as much provision. I don't think we had any really spike of COVID during the aspect of it, because persons followed the protocols and keep on emphasizing, and we had health persons who would have regularly gone to check to make sure things are okay. And there were things in place to assist people in case there's a need to quarantine at any shelter. So things were put in place to make sure persons are safe, so we don't have a disaster during a disaster upon a disaster on a whole.
Yeah, definitely. So, I mean, that's good to hear. I see another question from Claudette Pitts, who's asking about whether you can share any specific gaps or weaknesses that you had at the time of the eruption, and how you kind of dealt with these in terms of trying to, I guess, address those gaps, or how you're thinking about addressing them moving forward in terms of any gaps or weaknesses that existed within the response teams and the volunteers and the work that you're all doing. Oh, it's still muted.
Sorry, you will always find gaps one or the other in any activity. That is why there's always review. There's always the aspect of where we do a lot of simulations within our country. We actually, some years, when actually before we would have had our national simulation, whereby we would have actually tested out the aspect of if there was an eruption, and that is even before we were told that we might have a cultural eruption. We actually had that assessment simulation nationally, whereby we test the plan. But the good thing about gaps is that gaps show us where we need to fill in. So we took some positive approach. We didn't just discard persons or discard anything, but we took positive approach. Some of the gaps that we probably find was the fear factor. And I remember whereby when he's here, but there was a particular community where the deputy for the National Disaster Office had to really go and remind them that they were being trained, because more fearful is like when you talk about the simulation with real time, that is a challenge. Because with simulation, you know that you're acting, but in real time, you know it is there. And there was a particular community that was very fearful of taking the role of hosting. And they were really fearful of if they could manage. And he stepped in and really encouraged them to really, how to say, well, I see he just posted there that there were no major breakout in the shelter. That is our deputy for the National Disaster Office. And he was able to really remind them that the trainings that you would have done, this is now time for you to demonstrate your skill level. And that really helped us pull some of the gaps together. And we had lesson learned from the eruption, which helped us to understand. And also we had this thing that we normally fall to, when we share the negative thing that came out of it, we had those things, the rumors. We were able to capture the rumors that were being shared, and we were able to help those things so that we can prepare better. So I can say right now, we are much more better prepared and geared towards it. So the gaps and whatever would have happened, help us to know how to better upgrade our plans. And I know that Nemo and the Red Cross himself would have been revising a lot of stuff for better preparation in the future on a whole.
Okay, so I think we're running short of time, but I did have one other question here that I wanted to ask, which is from Mary Noel, where she was asking about what is the profile of the CDR team members? How do you guys ensure that the teams are inclusive and maybe taking into account the different vulnerable groups, persons with disabilities, elderly, children, that type of thing. So maybe if you could just give a very brief response to that, that'll be the last question that we'll take for now. And then we can take response to the others in the chat.
Okay, so part of their training is actually to capture all of those, the vulnerable persons, the persons who are, whether they have disability, they will do, that is when they do the DC assessment, they will do all of that. So part of their training is to know all those information before. Hence why when they were preparing for the disaster, the National Disaster Office would have asked them to make a list of all the persons and categorize them. So there are persons who actually would have moved before they even had the permission to, it was said to them to move. So some persons actually were moved before, because it might have been very difficult. So they found either family member, they found somewhere they could stay before. So we capture all those information all in when we are doing the Cdrd training. So then it helps us to better respond at the end of it all. All those information, the schools, the shelters, we have all those information we captured. Even the shops that are willing to assist say there's a disaster in the community, we capture all of those things one time in this Cdrd training.
Okay, so thank you very much for responding to those questions and for your presentation, which, as I said, was really interesting. And so I think with that, we'll move on to the next presenter. So thank you once again, and I'll hand back over to Candace.
Okay, and adding my thanks to Leroy for a great presentation as well, and really interesting to see how, you know, the coordination and the linkages and the partnerships have really been coming together in the work that you all have been doing to build resilience. So our final presentation, we want to have perspective from a civil society organization in terms of what they're doing to build resilience, what are their experiences and challenges and so on. And so I'd like to invite Mr. Brandon Walker, who is one of the directors of Barbuda and Go, an NGO based in Barbuda, to share with us his presentation, Barbuda on the Rise to Resilience. And of course, just to remind, we've had a presentation that gave us sort of the perspective from the National Disaster Office in Guyana, presentation just from the Red Cross, and so now the civil society perspective to try to round things out. Brandon?
Okay, so good morning once again. I am Brandon Walker. I am a director here at Barbuda and Go, which is a locally formed NGO in Barbuda from the year of 2018. And we are a NGO that really stands on 5 pillars, which are culture, history, environmental preservation, education, and disaster mitigation. And what our vision is to actually energize our community to be progressive, adaptive, vibrant, and resilient. That is exactly what we are doing. And I'm just going to share with you some of the things that we have done, some of the things that we are planning on doing to actually scaling up the community-based disaster. So there's quite a bit of stuff that we have done in regards to initiatives, in regards to workshops, in regards to outreach, studies and assessments, and campaign ads. And I would share with you some of that to show you exactly what we have been up to. One of the first major initiatives that we have conducted was the water harvesting initiative. That was back in 2019. And this came about because after Irma, which happened in 2017, a year after we were officially formed as an NGO, we were fairly new. We didn't have no data to go off of. We had to went out into the community. We had to do a lot of data collection. We had to do surveys, and we had to just gather information because persons were coming back to Barbuda after we were all evacuated. We had to come back to Barbuda, and as we were settling in the community, we wanted to assess where persons are in the recovery, first and foremost. How are they getting along? What are their urgent needs? And one of the things that we realized was that persons had a dire need for potable water. And as an organization, I think that we said to ourselves, this is something that we have to, lend a helping hand with. And we reached out. I think it was the ICF that came on board and supported us, because our initial goal was to supply 100 homes with potable water. And that was based on the assessment that we have done and the data collection and how persons indicated, water is the source of life. And it was important for families to kind of bounce back after Irma and, show some resilience in the community. And we launched that initiative. Our first batch of water tanks that arrived was, I think, 26. And then we had a next batch of 55. So overall, right now, we actually supplied over 85 homes with that water catchment system. That system was set up for families who, as I said, were in more need. It targeted elderly persons, any persons with a disability, and for persons that lost their homes completely and had to rebuild their homes from scratch. We really wanted to, let them be priority in terms of getting this water catchment system. And that's exactly what we did. And we really got a lot of assistance. We had volunteers that came out. We had our community showed really strong resilience. They showed up, they assisted us with getting the tanks dissected, getting them cleaned out, getting them prepped and ready for distribution. And I have to just use this opportunity to really thank those persons in Barbuda that really stepped up, being that we were a new NGO. It was 3 local directors, myself, Asher Frank, and Petrolina Isaac. And you know, we had to do our very best to bring some, to show some pride, you know, islanders, and really to show how resilient we are as a community. And, you know, persons turned up, as I said. We had truck services that volunteered their services to us and to get these tanks distributed to different homes in Barbuda. We, at the same time, we realized that the tanks cannot just be mounted on the floor. So what we did, we had to provide a spouting kit to each home, where the homes were, everything was retrofitted, and it was affixed to the different properties for the collection of water. So each home's got a spouting kit. Each home got the different fixtures that went along with the tank. And for persons that did not even have a platform to affix the tank, we made sure that we provided it to them. So persons, they had that as a concrete structure. That's something that would be, you can withstand any sort of storm. So in the future, that was something that they would always have to utilize. So, you know, these are the happy families at the end of the day. These pictures depicted some of the persons that acquired and benefited from this initiative. And we were really grateful to see how much assistance we got and how we could put some smiles on the faces of Barbudans. Now, this leads me into the next topic of the mangrove project. And as you can see on the screen, that was the eye of the storm, Hurricane Irma, that was barreling right across us on September 5th in 2017. This storm was one of the worst to ever hit the shores of Barbuda up to this day. People are still rebuilding, people are still recovering, and persons are, you know, trying their best to get back to a full sense of normalcy after this hurricane devastated Barbuda. We had winds of over 200 miles per hour that battered us for, you know, an entire night. And this really caused something extreme to happen in Barbuda, where the lagoon, which is a thin strip of land that separates the Caribbean Sea from the actual Codrington village, that was actually breached. And as you can see here on that photo, where that sand barrier is now, like, it was torn in two, that the sea, during the storm, actually, we had that rush of the Caribbean Sea actually coming right up towards the Codrington village itself. So persons' homes were flooded. There was a partial, the western part of the Codrington village was pretty much submerged into water. And this is an aerial view from, I think, the SVG Airlines. And this actually showed how there were some points in time when it seemed as if the lagoon was actually closing up. But unfortunately, with the constant winds and the constant, we know how the sea works, sometimes it gotten even wider. So that was a major problem that we're still facing up to the day, because the lagoon is still breached, and we are having a bit of concern for some persons, because the lagoon is used as a nursery ground for fish, lobster, and now it's open. You have a lot of other predators that have ventured right into this lagoon. And it begs me to, well, this picture depicts actually the hotel that you're seeing on that heritage is where it's actually now on the brink of would be submerged underwater, because here you can see it a little bit better, because this is right on the end of the lagoon. And when the lagoon breached, this part of the hotel actually collapsed during Hurricane Irma. So we have seen the destruction here. And what it begs to question is, what can we do at this point in time? For us, we no longer have this barrier of protection down there. That strip of land is now gone. And one of the things that Barbuda has depended on was the use of this mangrove that actually shielded us from storms, surges, and we have seen a highly reduced rate in those mangroves, especially on the eastern side of Barbuda, because we lost quite a bit of them due to the unprecedented battering that we endured through the Hurricane Irma. And this is why we are presently seeking assistance to boost up our mangrove nursery and the mangrove population. So this nursery would be so beneficial because by securing we know that the mangrove secures the shorelines, and this would actually prevent additional water from being barreled onto the shores of Barbuda, into the town especially, that is more vulnerable than all. And by replanting these, this will secure the shoreline once again. And these are the types of action that we are thinking of to really scale up the community resilience and ensuring that biodiversity also thrives. And we have become really more extremely aware of the importance of nature-based solutions to combat and mitigate against natural disasters. So as you can see this photo, before Irma, you could see exactly where the bird sanctuary lies. It was pretty green, it was pretty flourishing. And after, Barbuda was completely battered. Everything died, the flora and fauna. You could see exactly the type of images that we woke up to that morning after the storm. So we are a pretty flat island. The island lies below sea level. And this mangrove forest acts as a critical line of defense to storms, as I just mentioned. So the passage of Hurricane Irma further raised the consciousness of Barbuda and the wider community about the importance of the mangrove forest. And as I said, the southeastern tip of Barbuda was, I think, what is still trying to revive itself. We're still seeing signs of dead mangroves in the area. And it's important for us to replant and revive those areas so we could actually get a more secure coastline. So establishing a mangrove nursery, and when the time avails itself, and the organizing several replanting activities is one of the approaches that we look into contribute to making a more resilient against natural disasters here in Barbuda. We have actually went ahead. We're trying to be as proactive as possible. We had someone went and train to understand exactly how to involve in mangrove nursery. So they understand all the technical aspects of how to manage the nursery. And that person, I think just a few weeks ago, have completed that training. And they are now just waiting to see exactly how we're going to move forward, making sure that this is something that comes to fruition. And as a community, we all understand the importance of how the mangrove plays that dual role in our ecosystem. Because as I said, by planting of mangroves, it acts as a barrier to storm surges. And at the same time, we have fish and lobster that uses those mangroves as for their hatchlings. And because the lagoon is used as that nursery ground, they won't have predators there. So with that breach, that everything is being really put at a risk. And that is why we're trying our best to repopulate the mangroves, making sure they flourish and making sure they continue to be that strong defense that we need to withstand against other natural disasters. And this leads me to another important and fun topic of mine, which speaks to the parrotfish, and this ties into the restoration, and let me rather say the preservation of the coral reefs. as we all know that coral reefs is another defense mechanism against storm surges. Barbuda, we have coral reefs. We have a very strong defense when it comes to coral reefs, especially on the eastern side of the island, because nothing can dock on the eastern side of Barbuda because it's completely barraged with reef. What has happened though on the other sides of Barbuda, you have a situation where this particular fish, known as the parrotfish, plays a very critical role in our ecosystem. And a lot of persons may not know, but this fish actually keeps the reefs alive. They breathe a lot of life into the reefs. They're the ones that eat the algae from it, and they allow it to flourish. And with that, with removing them from that ecosystem, we would have a situation where we'd be faced with dead reefs. We would have a situation where the reefs would diminish. And then when we have storm surges, the reefs would no longer be there to act as that type of defense mechanism that we need. So we could see the connection here with the ecosystem. Everything ties into one another. So it's important for us to understand and know why preserving the parrotfish is the same thing as preserving the coral reef. And by preserving the coral reef, it reduces our risk in natural disasters. So we have actually numerous campaign ads. We have had a lot of awareness being thrown out there into the community, to radio adverts, to we have cartoon. One time we did a cartoon competition where villagers got to partake into it and pitching their ads and ideas as to how we could get the message across as the importance of the parrotfish. Even as recently, we actually had a competition as well where persons were given the ability to write about making the parrotfish a character in a children's book. So it outlines all the importance of the parrotfish, how it contributes to the ecosystem for more flourishing and healthy coral reefs in Barbuda. Barbuda is a fishing village. We depend heavily on the export of lobster, the export of punks, and it is important for us to really preserve our ecosystem, preserve these critical species that make it what it is. And the depleting of our coral reefs is also not only a major concern for Barbuda, but for Barbuda and Go, because not only does it protect the shorelines as well, just similarly to what the mangrove does, but it increases the preservation of biodiversity, and it also lends to tourist attraction. So we have embarked on a series of ads I have mentioned, and I think to educate fishers, and by advocating and engaging the community into discussions, we are further preserving our way of life by, without disrupting that ecosystem and more damaging towards it. So I think the ads would have strengthened the community to bring about awareness, and especially the impact that it has on the marine life. If we to actually remove the coral reefs from our ecosystem, I mean, that would be a whole other conversation we'll be having today. So what is—
Sorry, Brandon,
yes?
just giving you a 30-second warning. We're over time. So
No problem.
if you could wrap up.
So this was just a picture to show that there was amount of fish that was confiscated, and it shows exactly how persons were not aware that actually came into our waters to fish, and that these were actually picked up by the lagoon patrollers as well. So these were some of the ads that we placed out there. As you said, the chub fish, that is the local term that we call it here. It's banned. These were printed right on a t-shirt. So during our seafood festival, persons wore those shirts. They have gotten the ability to really have a lot of activities to engage the community as to spreading the awareness of this and how it actually makes the ecosystem better by being more aware of what this does. And just some problems that I've heard some of the persons have mentioned was the financial support that is needed, the technical support, buying, and human resources. That's some of the challenges we face as an NGO in Barbuda and Go. I know that we rely heavily on volunteers. But at the same time, our volunteers have only so much time that they could dedicate. And at the same time, they may not be have all the technical skills and knowledge to really assist us in these areas that really require a lot of financial support. And that brings me to the end. So if there's any questions, please feel free.
Okay, so thank you very much, Brandon. That was a really, really interesting presentation, not just because it added a different perspective, because you're a civil society organization working closely with the community in Barbuda, but also I think it was a nice kind of follow on from the fact that we started with Maria talking a lot about disaster preparedness and planning. And then we had that perspective from Leroy on how they dealt, it responded to a very recent disaster with the volcano. And now I think you're talking a bit more about the recovery side and how we kind of support communities as they recover after a very significant disaster post-Hurricane Irma. So I think that was actually really interesting, probably accidental, but it was a nice, interesting flow to the presentations.
Thank you.
So I think with that, I'm definitely going to open up the floor to see if people have any questions. I see a hand up from David Clark. I don't know if it's an old hand from previously, or if you still had a question, David, that you wanted to share, let us know. Otherwise, other people can feel free to post in the chat or the Q&A any questions they may have.
Yes, please. Good morning. My question is, okay, why some animals like cdrd are always closed off and others like crapping are open in terms of the endangered species, the preserving the endangered species of them? Certain animals, why some are always closed and others are open seasonally?
So I hope you heard that question, Brandon. I think
I didn't get it too clearly. If you could just repeat it for me.
So I think the participant was asking, how people decide what are the species that are closed versus open in terms of thinking about I think you're talking about dealing with overfishing, unsustainable harvesting of fish a lot in the coral reefs, and the fact that you're trying to encourage greater awareness around parrotfish and other important species. So I think they were just asking how people decide which of these species that should be protected, where the season is always closed versus those where it's open and it's easier for open for them to harvest.
Okay, great question. And one of the things here at Barbuda Go is that we believe in citizen science, and our aim is to foster a collectively conscious society that is acutely aware of the science that supports our Fishers Village. So we have produced the same radio adverts, cartoons that is now embarking on a mission, as I've mentioned, producing and publishing 2 books about the lovely character Pip, which is the parrotfish. So it's not based on what we would have just think is, it has a lot to do with research. It has a lot to do with data collection. And from those collection of data and the science that backs it, that is how Barbuda actually becomes one of those places to put a ban on the parrotfish. And just to quickly add also, Antigua and Barbuda is one state. The parrotfish is banned in Barbuda. It's not in Antigua. So Barbuda has really been very proactive with preserving and keeping this ecosystem very healthy and realizing that happens. So you'd have the situation where Antiguans who fish in our waters, persons would say, hey, it's not banned in Antigua, but you're just coming into Barbuda. So that's thin barrier, but still it's something that people got to be conscious about.
Yeah, so that's very interesting to hear. Thanks for that. I'm seeing a question from Jackie Burgess, who's saying great presentation, but she's just wondering about how you all are addressing gender mainstreaming. How do you think about issues related to gender and how you can be more gender responsive in the work that you do?
Oh yes, and we're a very all-inclusive organization, and we try our best, especially when we there's any sort of initiative and workshops, especially, we try our best to be including all aspects of society. I myself, as a director, two of my other directors are females as well, Katrina Isaac and Asha Frank. And we are very inclusive. I try our very best to, in all aspects, to engage and capture that all the demographics here in Barbuda.
Okay, so no, that's really good to hear. I think that's an important aspect, and thanks for that question, Jackie. I'm also seeing an interesting question. I actually think it was posed in a different way to an earlier speaker, but we didn't get to it, which is how are you guys considering or trying to provide psychosocial support in light of the recovery and thinking about the challenges that many Barbudans would have faced, being displaced completely from the island for a period of time before they can return, but also with the damage that you're seeing along the coast. It might be affecting fishers and other coastal marine resource users in terms of livelihoods. So, what's the kind of support that you all are able to provide, if any, for addressing those kind of psychosocial challenges?
Yes, and one of the things that we recently did, we actually opened up our community office here in Barbuda. And that is one of the main reasons also for us to be having that office here, because we want persons to come in. We have a support assistant programmer that works here. And that is exactly what they assist with in terms of, because we're still gathering information from the community. Persons are still coping. We encourage them to come into this organization, explain to us exactly what the challenges they are facing, and how we could be a support system to them. And also, we are a support system to the local government on the same, in the same respect. So that's what we're here for as that agent. And we're here to, ease the squeeze from the community, from local governments, so persons could really feel a sense of normalcy. That is what we're all trying to cope. And the thing is, in Barbuda, we're a very small society, we're a small community. There's 15 to 2,000 persons the most. So we are a brother's keeper. In whatever way or form, we try to bridge that gap, keep that connection, and try our best to help each other in any way possible.
Okay, so that's fantastic. So I think the last question actually is just going to be kind of one to wrap this all up. Given that our theme today was really about scaling up community-based disaster risk reduction, do you have any final sort of recommendations for what would help Barbudan Go and other groups that are working in this space to be able to scale up and out the type of work that they do? So maybe if you could just respond in 30 seconds, that'll be my last question, and then I'll hand over to Candace.
Scaling up, that is, recommendations for us, even right now, I try to encourage a lot of people to reach out to volunteers. That's very important. And volunteerism is good because it gets the ordinary grassroots individual involved, first and foremost. Let them be a part of it. That is how you intermingle and get the buy-in of the community. And that's sometimes difficult and even difficult for governments as well to see exactly the type of change that you want to see, because that's what I see ourselves are as well, advocates for change in policy. And the things that the ordinary person wouldn't say, at least the organization can be that voice. So I always encourage people it takes us to really move and to shift the way we focus and the way we think and the way we operate, being that climate change is a very whole load on our hands right now. And it's very important for us to shift the focus and shift the way of operating for us to really reach that goal that we're all trying to reach.
So thank you very much for that. I think that was a great closing comment for this section. And thanks to everybody who posted questions in the chat and the Q&A as well. Sorry that we didn't get to all of them. We actually had a lot more questions than we could get to, but hopefully we'll be able to either respond in the chat or collate and send responses after the session is completed so that we do get back to you in terms of the questions that you had. So with that, thank you again, Brandon, and back over to you.
Okay, thank you, Brandon, and thank you, Anka, for facilitating or moderating the Q&A. I do think also these are a great spread of presentations, allowing us to get, quite a good perspective from different actors and practitioners in the region. So I hope it was very interesting and informative for all participants as well. And as Anka said, we will try to get to any questions that we were not able to get to and see if we can get some responses to collated, if not before we end the session. We are a little bit over time, so thank you very much for staying with us, and we beg your indulgence for a few minutes more. Just to, because we have a lot of participants, we want to make sure that we give an opportunity to give inputs, especially if you have not had a question or had the opportunity to have your question answered. So we actually have to wrap us up a short Menti poll, and I will just ask my colleague Aaron to post the link to the Menti poll in the chat. We'd just like to ask you to click on the link and to give us your feedback, your perspective. The question is, what are the top priorities for scaling up community-based disaster risk reduction in the Caribbean? So this is just to give you a chance, all participants a chance to have some input on what you think top priorities are. And I see some responses already start coming in. We'll just give participants just a minute or two. I think the link was posted. And try to repost it again, just in case. Okay, so I see some responses accessing finance. And I know our last speaker, Brandon, spoke about that. Resources and training, definitely. And I again, one of our speakers, in fact, all of our speakers, I think, highlighted that aspect, and we had some very practical feedback from, not feedback, but sharing from the SPG Red Cross and training they've been doing. Inclusion of local community groups, training of trainers. So speaking more so to methodology, more culturally appropriate psychosocial involvement in all levels of disaster response. Right, and I see multiple responses coming in about finance and multiple responses about training and I guess capacity building, psychosocial support. So I'm not going to read out all the responses. We definitely want as many responses as possible, and this link will remain active. So you can definitely go on the link and continue putting in your information. And just by way then of wrapping up, what we will do next, or in terms of next steps, we will be sharing this information from the Menti poll. We will be sharing the recording of the webinar and the presentations. So copies of that will be shared with all participants. And as I said, we will follow up to see if there are any questions that remain unanswered that we can help with. In terms of other next steps, as I said earlier today, this is the first in our webinar series, three-part webinar series. And so you can expect to hear from us on 2 more webinars, which will be happening in this series in September. So we'll be putting information out on that quite soon. And the other 2 themes that we are looking at is really based on gender and social inclusion, as well as nature-based solutions or ecosystem-based disaster risk reduction. And so I know there are a few questions and even contributions from presenters that started to talk about some of those. And so we hope to continue the conversations and continue having dialogue with multiple actors in the region who are interested in resilience and building resilience. So with that being said, I would like to thank once again all of the presenters. I would like to thank all of our partners, particularly and Sedima, who's been on the call with us, the IFRC Caribbean. And they have really helped us to get the conversations going. They have helped us to get our presenters on board, and I think share really great perspectives from across the region. So thank you very much for that. And last but not least, I would like to thank our project donor, the Inter-American Foundation. I believe we had a representative on the call. So thank you very much for supporting our project and supporting the work that we are doing on resilience in the region. Thanks to also my Canary team for supporting this webinar, and to all the participants for your time and for joining us, your active contributions and your attention. So we look forward to having you join us at the next two webinars. Thank you and take care.